Hey guys, welcome to my presentation on point-of-care testing. In this PowerPoint, I'll be talking a little bit about two different kinds of point-of-care testing. The first is the iStat machine, which is used to measure blood chemistries, and the second is portable flow cytometry. So stick around and enjoy the ride. So the first part of point-of-care testing I wanted to talk about was the iStat machine. Now, the iStat machine is a portable device similar to a blood glucose monitor that's used to test patients' blood for many different common laboratory tests. It's operated by inputting the operator's information, the patient's information, and then obtaining the blood sample and putting it into the cartridge. It takes anywhere from 2 to 5 minutes then to get results. The results appear both on the screen of the iStat so that the user is instantly aware. They can also then be taken back to the base station where they can be printed, and they are also automatically uploaded to the patient's chart if the hospital or healthcare organization purchased that feature. Now, the iStat machine and the software included is about $6,500 per unit. Test cartridges for various tests range from $5 to $14 each, and obviously that varies based on the test. Something that's testing for something simple or just one test, like a creatinine test, would be around $5, whereas something a little bit more complex, like a Chem 14, would be on the range of $14. And then in addition, there's a required maintenance contract of $750 per machine per year, and that includes software updates and support for the iStat machine. So what do we use the iStat for? Well, there are a number of ways that we can use it in emergency situations for acute patients. For cardiac indications, we can use it to get the B natriuretic protein, CK and CKNB, electrolytes and chemistry. These various tests, of course, we know might be indicative of a dysrhythmia or an acute MI, some kind of ischemia, something like that. It can be used for respiratory indications to get an ABG, magnesium or pH. Of course, ABG telling us a little bit about what kind of oxygenation and how much carbon dioxide a patient's retaining. pH could indicate respiratory alkalosis or acidosis. Can be used in trauma indications, lactate, pH, BUN, and creatinine. A lactate, if there is a lactate or a low pH, that may indicate metabolic acidosis, which is associated with a crush injury or cellular death. BUN and creatinine can go along with metabolic acidosis, which can result in renal failure, but are also important not only in trauma but also in stroke protocol to identify if a patient is a candidate for CT contrast or IV contrast for their CT scan. And then in hematological and circulatory indications, of course, if we have a patient who appears and has chronic disease and we want to know something about their immune status, we can get their RBCs, their white blood cells, and their platelets. If we're concerned about Coumadin or heparin toxicity, we can get their PTT, PT, and INR. For patients who generally appear weak, pale, anemic, we can get their H&H, and for patients who complain of chest pain with shortness of breath or calf pain, flank pain, something like that, we can get a D-dimer to rule out DVT or PE. iStat, of course, is useful in an emergency setting where patients have acute needs, allows us to get test results within a few minutes as opposed to 45 minutes to 2 hours for typical laboratory testing. But it's also useful in non-acute care settings, including physicians' offices and other health clinics. In physicians' offices, the iStat machine can be used instead of traditional laboratory testing in order to provide patients with more immediate laboratory results that can aid in more swift diagnosis and treatment. Oftentimes this can mean for patients that they may be able to be diagnosed in one visit instead of having to wait several days for their test results and then coming back for another visit. It also importantly allows remote testing of patients in rural settings who have limited opportunities for contact with healthcare providers, um, or is a tool of traveling nurses and physicians to be able to travel out and provide all of that care for the patient in one setting so that we are ensuring their continuity of care. Now, the second thing I wanted to talk about was portable flow cytometry. Portable flow cytometry is a new technology, but flow cytometry itself is a long-utilized tool in laboratory diagnostics. Flow cytometry is a technology that takes the cells from a blood sample and mixes them with the fluid, and then projects that fluid across a laser beam at a rate of about 30 to 40,000 tiny droplets per second. And each of these droplets has anywhere from 1 to 2 cells, maybe no cells in it. The idea is that we want to get an individualized picture of each cell as it passes the laser. When light reflects off the cell from the laser, it reports to the cytometer exactly what kind of cell it was seeing based on the light pattern that's reflected back. This is useful for immunoassay. It allows us not only to get a count of white blood cells, but it allows us to differentiate between them, so we can find out about segmented neutrophils, immature bands, different lymphocytes, that paint us a better picture of exactly what's going on with someone's immune system. It allows us to see antibodies and other white blood cells, which we wouldn't be able to get with other technologies. This is particularly important in the maintenance of patients with viral infectious diseases, particularly HIV and hepatitis. In HIV, the progress of the disease is monitored not only through measuring the viral load, but also through counting the number of CD4 T lymphocytes that a patient has. This new portable flow cytometry, this new technology, allows us to take this CD4 T lymphocyte testing to patients in rural areas or underdeveloped countries that would not have had access to the traditional testing that they need in order to adequately maintain their HIV treatment. Most interestingly, this technology is expanded even further. A couple months ago, there was a study about a new type of portable flow cytometry that allows us to, by projecting multiple laser beams, allows us to find out about more than one cell type in the same sample at the same time. This is particularly important in pediatric patients, for example, who do not have normal ratios or a standardized ratio of white blood cells that adults typically do. So in order to get meaningful data about the number of CD4 cells that they have, we need to be able to compare the number of CD4 cells that they have to the number of CD8 T cells that they have. This new technology would allow that to happen. Now, this portable flow cytometry has been around for a few years, but the equipment is getting, or the technology is getting more advanced, the equipment's getting smaller, and the cost is coming down to the point now where there are portable devices, only in the prototype phase, but there are portable devices that one firm in particular, there are a number of firms vying for contracts on this, but one firm in particular claims that they can produce at a cost of $250 per unit, which is incredibly amazing when you think about the amount of technology and research that went into these. And most importantly for nurses, these portable flow cytometers allow for nurses or other healthcare workers who are not laboratory technicians to use flow cytometry without knowledge of exactly how it works. They're very user-friendly, like the iStat machines. So. This is a picture of a portable flow cytometer. This is an older model, probably would cost several $1,000s, and obviously it's not very portable. The new model is in the prototype stage, and I couldn't find a picture of it. So your discussion questions, what are the advantages of point-of-care testing? Are there any disadvantages? Name potential barriers to point-of-care testing. Or name 2 to 3 settings or give 2 to 3 examples in which point-of-care testing can improve patient care. How is patient care improved in this way? What I really want you guys to think about when you're answering these discussion questions is the experience that you've had in your preceptorship or in where you hope to go, what field you hope to go into in nursing. Think about the patients and how they would be affected by point-of-care testing there. So, that would be my presentation. I didn't want to bore you with a million boring slides, so I decided to narrate it instead. I hope you guys enjoyed it, and good luck.